everyone. Again, my name is Suzie Bahmanyar, and I'm one of 3 health science librarians at the university. I'm pleased to present Ricardo Pimentel, a senior at San Jose State University who is studying justice studies and minoring in psychology. What I've appreciated about working with Ricardo is some of our shared interests. Ricardo is interested in joining the military, and I am an Army veteran. He is interested in possibly becoming a psychologist, and I worked in behavioral health. And we have another shared interest that he's going to talk about in his presentation. We decided to look at a current problem in society that combines both the military and psychology. So without further ado, please welcome Ricardo Pimentel.
Ricardo, are you able to share your screen?
Yes, sorry, I was just muted there.
Okay.
Okay, let me see if I could do this.
Okay, great, thank you.
I'm an attendee. I'm not a, I'm not able to.
Oh, okay. Let me see where you're at. Just a second.
Yeah, no worries.
You should be a co-host now.
You're a co-host. You should be able to share your screen.
Okay, yeah, I am now. Okay.
Okay, perfect. Thank you.
Now let's see if I can.
Oops, don't leave the room. We're on the slide purpose of the study, if you want to backtrack a little bit.
Ooh, okay, technology is not my favorite thing. So see if I can minimize that as well. Okay, hello everyone. I hope you're all doing well and staying safe and indoors. My name is Ricardo Pimentel, and today I will be presenting my research towards the attitudes and beliefs of veterans with PTSD towards their service dogs. So just a very brief overview. We will first have a brief introduction into the topic. I will state the purpose of my study. We'll look at the theoretical framework for which I am hoping to build off of, and then we will analyze the survey that I completed. I'll mention the limitations of the research and where matters stand right now, and then we will end with a brief conclusion on everything discussed. Okay, so now to begin, post-traumatic stress disorder, or PTSD for short, is a mental health condition that is triggered when an individual either experiences or witnesses a terrifying event. Symptoms of PTSD may present themselves in the immediate aftermath of the terrifying event, or they may have a prolonged and delayed onset. Symptoms common to this health condition are unwanted flashbacks, nightmares, anxiety, depression, negative changes in mood, adverse physical and emotional reactions, avoidance responses to a variety of stimuli, and unwanted, really uncontrollable thoughts about the terrifying event that the individual either experienced or witnessed. PTSD in any given year has been reported to afflict just north of 3% of the US population, but it is a particular issue for military veterans, with more than 15% of American veterans having been diagnosed with PTSD at some point in their lives after their military service. And for many of these veterans, their symptoms are chronic for a variety of reasons, which we will get into. Today, years and years of foreign wars have resulted in millions of American military members being deployed. Upon their return, a substantial amount of them report experiencing psychological difficulties as a result of their military careers overseas. And one report approximated that 20% of military personnel returning from Iraq and Afghanistan have been diagnosed with PTSD or major depression. And this may, however, be a significant underestimation as for example, delayed onset PTSD has accounted for some 40% of PTSD in Vietnam veterans in the decades after their service. And very disturbingly, in 2012, military suicides had recorded a record high, outnumbering combat deaths in Afghanistan. And military veterans have consistently accounted for upwards of 20% of an approximate 30,000 suicides in the United States annually. The Department of Veteran Affairs has been widely criticized by numerous scholars for providing insufficient care for a large list of military members with psychological difficulties. In 2013, they had a disability backlog that exceeded 900,000. These claims were made by veterans of the Iraq and Afghanistan wars. However, also Vietnam veterans who were just now seeking treatment for their delayed onset PTSD. The VA does provide veterans with PTSD evidence-based treatments that have proven to be effective, such as exposure therapy, prolonged exposure, and cognitive processing therapy, along with other pharmacological therapy, so medications. But not all veterans respond to these treatments the same for a variety of different factors. And given the massive amounts of veterans who are in need of a variety of services, the VA frequently finds themselves simply overwhelmed by the demand. Coupled with this, those who do not respond positively to these evidence-based treatments are left with little to other possible courses of action. And as these treatments are so slowly adopted into standard practice, usually after years and years of research, many veterans simply do not have the luxury of time to wait for viable treatment options. So what has resulted is a growing list of grassroots organizations who are seeking to pair veterans with PTSD and other mental health disorders with service dogs. For the purposes of this research, I have defined service dogs to be inclusive of any dog that has been appropriately trained to provide their veteran caretaker with some level of therapeutic or emotional effect. So this would include psychiatric service dogs, therapy dogs, and emotional support dogs. So what I'm hoping to show with the completion of this research is what are the attitudes and beliefs of military veterans with PTSD towards their service dogs, and whether or not these military veterans believe that their service dog is providing them with any amount of therapeutic or emotional support, or at least to warrant a growing acceptance of service dogs as a viable treatment modality for veterans with PTSD. So right, as I mentioned just a few slides back, the Department of Veteran Affairs is frequently barraged with claims that their actions are generally insufficient to meet the needs of so many veterans. This of course includes the needs of those veterans with PTSD. In response to these claims for more action on their part and the growing list of grassroots organizations that are claiming to provide services to veterans for a variety of needs, the VA has begun to understand the limitations of current treatment modalities for PTSD, and they are continuing to develop a growing list of what they call complementary alternative medicines, or CAM. So a growing list of these organizations are providing veterans with therapeutic dogs, and many of these CAM treatments are not rigorously tested and have not gone through extensive evidence-based research trials, but they are being utilized more frequently by more veterans, and they are being described by those in the VA as reasonable alternatives to the traditional treatments offered at their clinics. And looking specifically at the organizations that are providing service dogs to veterans with PTSD, as we stand today, there remains not too large a breadth of research into the therapeutic effects of these service dogs for the veterans. A handful of studies have been completed in the past where the preliminary data does suggest that service dogs do elicit some positive effects in reducing the symptomology of PTSD in veterans, but this list is very small and much more research is in the works as we speak to evaluate the connection between veterans with PTSD and service dogs. So given all of this, we now lead into trying to answer in part the lingering question of whether the veterans themselves believe that they are receiving therapeutic benefits of having a service dog companion. So for the research we'll be examining today, we will be looking at the statistical data collected from a survey I distributed to 7 different organizations found across the country. These organizations include Positive Teams, Mutts with a Mission, Puppy Jake Foundation, PALS, Puppy Behind Bars, Service Dogs for America, and the Sam Simon Foundation Assistance Dogs Program. Now, all of these organizations are all Assistance Dog International certified or ADI certified, and they provide outstanding services to their clients. It was interesting to learn that it is very typical for the cost of one dog to be housed, fed, and trained to be a service dog. It usually amounts to anywhere between $20,000 to $30,000. This process also typically takes about 2 years for a service dog to be paired with their human companion. I first came into contact with these organizations through an introductory letter that I sent out explaining my reason for wanting to conduct my research and asking if they would be able to serve as sort of conduits and first receiving the survey from me and then sending it to their clients who meet our survey population, which is veterans with PTSD of any age and who have received their service dog, or if they're in the process of receiving their service dog. So now looking into the data, again, please bear in mind this is preliminary data and these figures are subject to change. Analyzing the data of 8 survey participants, I found that all of these survey participants were within the age range of 25 to 54, and they reported having been diagnosed with PTSD. Three of the participants had served in the military after 2001, with the other participants serving between the Vietnam War and the Gulf War. They had all reported as having served in a combat or war zone. Now, when asked if they had sought treatment modalities for their PTSD, 7 participants responded that they had, citing that they had sought in the past medications, therapies, and other non-conventional forms of treatment. 4 of the 8 participants reported having been first made aware of service dogs as a complementary treatment for them through family and friends. Now, when analyzing how the participants sort of felt about their service dogs, it begins to become very one-sided. So after having been paired with their service dog, most of the participants, upwards of 86%, responded that they had felt more connected with their surroundings, other people, and towards other activities. They had fewer nightmares about their traumatic event and generally had a better mood throughout their days. I posed this question twice to the participants, having them first reflect on their time before their service dog and then reflecting on the present and their time now with their service dog. Right, and we can see here in the 2 graphs the attitude shift between the participants, before they received their service dog, and then on the right after they received their service dog. And this shift in attitudes is quite dramatic. It could be a little confusing at first looking at yes and yes, but we have to look at here the table. They were worded a little differently, the questions, but for the most part they asked the same. They asked the same. No, they're along the same lines. So moving on, 7 of the 8 participants responded that their service dog had improved the quality of their life, and all of the participants responded that they were moderately to extremely satisfied with their service dog, and also that they had an overall positive experience with their service dog, with the participants universally agreeing that they would recommend a service dog to other veterans with PTSD. Despite these overall positives of having a service dog for these veterans, the majority, 72%, responded that they were not receiving any support for their service dog, despite feeling overwhelmed by their service dog, at least sometimes. Those that were receiving support were receiving either monetary support or training support for their service dog. And this was usually coming from the organizations and from the VA. When questioned if they were seeking any other forms of treatment for their PTSD, along with their service dog, not including their service dog, 87% of the participants responded that they were, with these being a mix between therapy, medication, and professional specialists, with one respondent reporting that church was providing therapeutic benefit for them. Some immediate limitations that I want to very quickly discuss with you all is that, despite having been in contact with these organizations and having gotten approval to distribute my survey to their clients, the current situation that we all find ourselves in surrounding COVID-19 has made the facilitation of the survey less than ideal. It is my belief that several of these organizations are closed, in compliance with several state orders to stay at home, which I cannot fault them for. This has pushed the distribution and completion of the survey very much to the back burner for several of these organizations. And further, also given the rather impersonal nature of surveys, it does make it difficult to gauge the motives for a respondent to participate in the survey. There can be two extremes where participants either want to participate because they truly believe in the therapeutic benefit of their service dogs. And then there may be others who have a completely different belief. So it is difficult to ascertain the motives of participants, but given the pool of participants that we selected from, which were all ADI organizations, I am confident that the preliminary results do possess the power to withstand criticisms if there were any. So again, I do not know when most of these organizations would be able to distribute my survey to their clients in totality, but as it stands, the case study will require further statistical data analysis. But nonetheless, the responses I have collected do demonstrate the significance of service dogs for military veterans with PTSD. So lastly, in conclusion, through the interpretation of the preliminary results that I have analyzed, veterans with PTSD have an overwhelming positive belief that their service dogs are providing therapeutic benefits. Pretty consistently, most participants responded that their service dogs were helping ameliorate their symptoms of PTSD, and that they would recommend a service dog to others, to other veterans with symptoms of PTSD. It is worth mentioning also that several obstacles exist when veterans with PTSD are seeking to become paired with a service dog. For one, not many of these organizations exist to train these dogs. When we first sent out our introductory letter, we contacted all of the organizations, and the list was no more than 30. That was all in the entire country. So, and for good reason, it is a extremely labor-intensive process that is very reliant on private donations, as they are not funded or directly supported currently by the VA. Though the VA will assist in some capacity once the veteran has received their service dog, it's almost never substantial enough. For these reasons, it is so very important for more research on this topic to be conducted. It is my hope that more research will be conducted so that a greater case for pairing veterans with PTSD with service dogs can be made. And yeah, just lastly, I just want to give a big thanks to everyone, to the donors of the program. As an undergraduate student, we aren't always presented with opportunities to conduct our own in-depth research, let alone are we ever really given the tools and resources to be able to do that successfully. With this program, though, I was able to take control and move forward with the passion of mine, which is research. I would also like to thank, of course, all of the presenters that gave their presentations throughout the entire year. They were all very informative, and they helped shape what the program became. And lastly, the mentors. Everyone, Yen, Emily, Deanne, and of course Suzie, Thank you for your overwhelming support throughout the entire program's duration. I know for a fact that without your guys' advice and mentorship, I don't think any of us would have been able to progress as much as we have in our young research careers.